So sometimes midwives are so used to using abbreviations in their language that they don't realise they're using them. And they forget that other people don't know these terms. Or sometimes they'll use a figure of speech like, I'll be back in a minute, but they don't mean a minute. Sometimes they arrive back after 2 hours. So when engaging with anybody, I would just advise that if you don't understand what they're talking about, please ask them to explain. But in the meantime, here are some examples that I could think of. So you'll hear something called a booking appointment. And this is the initial appointment with the midwife where they'll go through health questions, lots of personal questions and medical questions. You will be given a lot of information about screening and tests available. And this appointment can be a little overwhelming, so you are welcome to take somebody to that appointment with you. You can take notes if that would help. You could ask if you can record the appointment, just so that you can play back the information given to you when you're at home. And you can also ask the midwife just to pause if you need time to process what's been said. At your booking appointment, you'll often be given a named midwife, and this means that this is the midwife that's overseeing your care. However, this doesn't always mean that you will see that midwife at every appointment. You find that you are not quite getting on with this midwife, you can ask to change to somebody else. Something that you will hear often in pregnancy is your due date. When you're first pregnant, your midwife will use a very old method of calculating your due date, whereby they ask you for the date of your last period. They'll add 7 days and 9 months to this date, and that will give you an estimated due date. And this estimates roughly how many weeks pregnant you are. You will then be offered a scan, which takes a measurement of your baby and again gives you an estimated due date. Sometimes women know the date they fell pregnant, especially if they've had IVF, and often this date doesn't match the date that the health professionals give you. This can be sometimes really frustrating. So I would advise to use this date as an estimate. It is an estimated due date, and actually only 5% of babies are born on this date. Most babies are born between 37 and 42 weeks, and that's an awfully long period. A midwife called Sara Wickham covers this topic in great detail in her book, In Your Own Time, if you want to find out more about the history of due dates. But during antenatal appointments, you will be asked certain questions, and I wanted to just explain what some of these questions mean, especially if this is your first pregnancy. Any question that involves touching you is a consent question. They're asking consent to touch you or to do something to you, which you can accept or decline. So if you don't understand why something's been offered, then you can certainly ask them to give an explanation, and then you can make a decision whether you consent or decline. So some common questions that you might be asked, can I do your OBS? And this means that they would like to measure your blood pressure and your pulse. And if you're in hospital, this might include measuring your temperature as well. So can I do your OBS means observations, and they want to perform those on you. At your antenatal appointments, you will be asked if the midwife can dip your urine. And this means that before you arrive for your appointment, they will have asked you to provide a sample of urine, or you can provide a sample when you're there, in that you will be asked to wee into a small plastic pot. And dipping the urine just means that they will insert a paper strip into that urine, and this paper strip will tell them if you need further testing, or if you have signs of a urine infection, or you have any blood or protein in your urine. So from 26 weeks, your midwife will ask you if she can measure your baby's growth, and this will involve you lying on a couch in like a semi-upright position, lifting up your dress or your t-shirt so that the midwife can touch your stomach and determine which position your baby's in. They will also want to measure from the top of your uterus right down to your pubic bone, and this is measuring your baby's size. This is performed so that they can then put that measurement onto a chart and determine if your baby is growing as it should. Fetal growth should progress week on week, and this measurement should be performed every 2 weeks. Later in pregnancy, your midwife may suggest booking you in for induction, and there is another video that goes into induction of labour in depth, but know that this is a recommendation of treatment. It's not, you are required to consent to this appointment. So when in labour, you may hear certain abbreviated language mentioned, such as performing an ARM or a VE, and these relate to performing an artificial rupture of membranes or breaking your waters, and a VE refers to performing a vaginal examination. Both of these procedures are mentioned in other videos, which you can access to gain more information. During conversations, your midwife may say, we will allow two hours for labour to progress, or we will allow you to go for a walk. And the word allow is often used by midwives, but it's simply referring to a recommendation. It's not that they're allowing something or not allowing something. You have a choice in your care, and you are able to decide whether you want to do something or not. On the other hand, you may be told something like you're only allowed one birthing partner with you in labour. Say, for instance, if you feel that having 2 birthing partners would be more beneficial to you, then these guidelines can be negotiated, and you can certainly speak to a consultant midwife or the head of midwifery if a certain guideline is a barrier to your care. In relation to early labour, women are often recommended to stay active in early labour. Being active in early labour is really beneficial because it can gravity can help your baby lower into the pelvis, and it can help labour progress. But sometimes if this information is taken literally, women will forget to rest, and they'll forget to sleep, and they'll become so hyper-focused on staying active that they get extremely tired, and you really need energy for labour. So if you're recommended to stay active in early labour, yes, stay active. But if you're tired, sleep. If you need to rest, please rest. Please eat and drink as normally, because these things will all give you energy in labour. Take a warm bath for pain relief, watch a movie if that's what you want to do. But staying active in labour is just a recommendation, and it's also beneficial to listen to your body. And the last thing I'd like to mention in this video is that sometimes plans change. So when you are, say, for instance, in labour, and your midwife has made a plan, so they're gonna, listen to your baby's heartbeat in an hour, and they might do a vaginal examination in 3 hours. These plans can change very quickly because labour is quite unpredictable. It might be worth talking to your midwife beforehand about how you would like changes communicated to you. So your midwife can certainly try and prepare you for changes in advance, but sometimes this is not possible. So how would you like those changes communicated to you? Do you want your midwife to talk to your birthing partner, for instance? I hope you found this video helpful. Thank you.